I have had the opportunity to work in multiple medical settings. And this is the first time that I've had an opportunity to know that each and every patient that I see every day is an opportunity to change someone's life and to change our community. At Charles Drew, we are blessed to not only be able to provide education to our patients, but to be able to reach a high-risk population that doesn't have the same access to healthcare as the general population does. Our patients are not only very thankful for the services that we provide, but we know that each patient that we speak to is reaching a segment of the population and that has either been ignored, sidelined, or somehow been left out of the process before. Now, instead of taking care of someone when they're in the midst of the final complications of a disease, I actually have the power, the ability to be able to give that patient the education, the knowledge, and the tools that they need to prevent themselves from ever getting to that point in the first place. It's one thing to be able to barely save someone's life. It's another thing to be able to prevent that person from getting in that position altogether. I had the opportunity to see a patient that had diabetes for over 15 years. This person's diabetes was completely out of control, and they were at risk for multiple infections and were possibly talking about an amputation down the line. When we sat down to discuss what diabetes was, how to keep it under control, after going through the education with the patient, she turned to me and said, "Why didn't anyone ever take the time to explain this to me before?" It turns out that even though she had diabetes for over 15 years, no one had sat down to explain to her what the disease was, how it works, and how she needs to treat it. Within 3 months, she was one of my most compliant patients and is now no longer requiring insulin, able to control her diabetes with just oral medication. At that moment, I knew that what I was a part of was something bigger than I had ever done before. This was the way to practice medicine, and this is where I wanted to be. We are not just a clinic that sees those that don't have health insurance. We're not just a clinic for those that have barriers to access to care. We're not just a clinic to see patients that don't have anywhere else to go. We are the face of healthcare in North Omaha. We are Charles Drew because we are the community. We believe that it is our purpose and our mission to make a change in the North Omaha community by providing care to every single resident that is in need of medical care, in need of education, in need of food assistance. Whatever it is that our community needs, that is what Charles Drew will be.